Minister Dr. Henry, we have a piece up on the site today explaining how Canada crushed the curve, the COVID-19 curve, compared to the United States. And there are a number of theories why we've done so well here, including in British Columbia. Perhaps Canadians are more compliant. We're more rule followers than rule breakers. And I think there is synchronized public messaging and really to-the-point messaging from people like Dr. Henry, a very no-nonsense approach. But I'm wondering, could you summarize how the factors or the one main factor that helped Canada crush that curve compared to the United States? What was done so differently here? Thank you.
I don't know that there's one single factor, but I think you've mentioned a number of them. You know, the fact that we do have a consolidated approach across the country, that we have been through challenges before where we have worked together, where we have chief medical officers of health, my colleagues across the country who meet regularly and met regularly very early on and raised the alarm. We have that interaction with our political masters, which works in this country, in that we have that respect and that distance and the ability to speak directly to the population about health issues. Another thing I think is absolutely critically important in Canada is our public health care system, where people don't have to pay for a test, where they weren't worried that if they got sick they would not be able to get care. That to me is an incredibly important piece that we have underlying what we do in Canada. I also want to say that we have some incredible experts around laboratory testing and development of tests, and we had both here in BC but in Canada, across Canada, our National Microbiology Laboratory and our Public Health Lab Network was able to develop tests, and we used them widely very early on. So those are just some of the things that I can think of. I don't know if you address that as well.
I just think public health care is at the core of that. The fact that, as Dr. Henry has rightly said, that people have access to our healthcare system without payment. We have a single-payer healthcare system, and that makes an enormous difference. It makes an enormous difference for more than just the fact that there are millions of people in the United States that don't have health insurance. It means that we have an organized public healthcare system, that when Dr. Henry and Steve Brown started to chair our response to COVID-19, all of the health authorities were in the room, including the First Nations Health Authority, and part of that. Whereas the effect in the American system, I think, is more truncated. But all of that said, COVID-19 is an extraordinarily difficult problem in the world, for all health systems in the world and for all people in the world, and we're seeing that. And the results every day, whether it's someone we lose in a care home who passes away due to COVID-19, or case positive tests like today, which are significant and high, and for us a single day record. It keeps us humble. This is a very difficult challenge. It doesn't just involve public health care or health systems, but involves our entire society. And it's really an unprecedented challenge in our lifetime. And I just want to say, with respect to the United States, that I know Dr. Henry would agree with this. Dr. Henry talks to our colleagues in Washington State and Alaska all the time, for example. And there are people doing extraordinary things in the United States, and communities doing extraordinary things. And I think in a worldwide pandemic, what it tells us is that the world is interconnected. And what happens in Iran matters here, and we've shown that. What happens in other parts of the world matters here. What happens in the United States matters here, and vice versa. And that we need a world where we work together. And that's why, contrary to sometimes the popular debate where it's easy to blame institutions, we need world health institutions that bring all of us together. Because this pandemic isn't a BC problem or a Canadian problem or an American problem. It is a world problem. And we need to work together, and we can only succeed by working together to help solve it.